Hello, good evening. A very good evening to all of you. Today we are going to see the case now of Bethany Taylor, a resident at Golden Pond Retirement Village. She needs urgent admission to the hospital, and you are the night nurse looking after her. So you know your position, and you are a night nurse. You are working at Golden Pond Retirement Village, and Bethany Taylor is a resident of the retirement village. So this is what we have understood from the preliminary part. We do have a small correction here in today's date. This is actually 10 July. It's not September because it might be a printing error, because you have today's date here as 10/7, that is July. So we are transferring the patient to the hospital on 10th July. So we're going to write on 10 July, not on 10 September. That's it. We do have a small correction in the question. Please note that. And write a letter for the doctor of the OTN's hospital emergency. So hospital emergency department doctor, you are going to write to. You have to go ahead with the recent history of events and also the patient's past medical history and condition. This is what we have to see in the letter. Let's go in detail what is needed here. Now we do have an address here, marital status, date of birth, country of birth, that's nationality, how she became the inhabitant of this particular village after her husband's death in 2010. There is a son, Nichols Olsen. He is somewhere. So retired triple certificate nurse, was the matron of a small country hospital for 15 years. Very aware of an interest in health issues, likes to discuss and to be kept fully informed of any changes in medication or treatment. Normally alert and oriented, enjoys bridge, bingo, and reading. These are all the things which we don't need because this is an emergency case. So as far as this is an emergency case, we are focusing on the emergency case. And the second thing that we are going to include is the past medical condition as asked. So let's go with the condition. So we have arthritis, we have glasses, incontinence she has. And this is something very important. She has hypothyroidism, hypertension, glaucoma. And one more thing is that she is allergic to penicillin. So these are all important data. This is the past medical history. It's very, very important, and it has to be included in the letter. And the medications which are going. So this is another thing that we are going to include. What are her regular medications? So we have got a look, and we have some non-prescribed medication too. And that this is an important data. We don't need this flu vaccination. It has no relevance with the current situation. So we don't need flu vaccination actually. So we can summarize these things from 29 to 9 into a sentence or two sentences. So we don't need to explain all these things in detail, but we are to concentrate on the very recent history, that's on 10th morning and evening. So this is what we are focusing first. That is the very recent history. So what we can see is that patient was nauseous, patient had insomnia, patient had shoulder pain, neck pain. So we have assessed her BP, and that was 175/95. So what we have given is a normison and a Panadol to pacify her at 9 p.m. But she complained of persistent pain, pale and sweaty she became, and her BP elevated to 190/100 by around 9:35. So we have assessed her condition as a medical emergency, and therefore she is being transferred to your facility. And this is what the thing is. Now, 10 July, as I told you, 10 July, this is the date, and that is not the date. Today's date, it's misspelled there. So this is the date. The doctor, dear doctor, Mrs. Bethany Taylor, 1st January 1929. Let's go over the letter in detail. This is the purpose. So this is an immediate transfer. So I'm writing to transfer Mrs. Bethany Taylor, a resident of ours, who currently has persistent chest pain. So you have to add the word currently. It means at present. At present, she has persistent chest pain and uncontrolled blood pressure. At the time of admission, at the time we are transferring the client to your care, he's experiencing persistent chest pain and she has uncontrolled blood pressure. This is what we have written there. She requires urgent assessment, management, and care from your facility. So that is our requirement. She requires urgent assessment, management, and care. And today evening, so this is the most recent history that we have separated into paragraph. Today evening, during routine home visit, Mrs. Taylor reported mild nausea, insomnia in association with shoulder and neck pain. So all these conditions are summarized in one particular sentence. On examination, her BP was recorded as high as 175/95. And by 9 p.m., she was given normison and 2 Panadol tablets. So this is what we gave her. We gave her one normison and 2 Panadol tablets. And we waited till 9:35. In around 35 minutes, her condition became worse along with further rise in the BP. So we have an elevated BP. So it's written 190/100. Analyzing the medical emergency, an immediate transfer is arranged to your facility. So that's what the present condition of the patient. Now let's see what happened to her in the morning. In the morning, her BP was 180/95 and was confined to bed complaining of generalized weakness. So today morning, she complained of these many problems. So she had generalized weakness, her BP was elevated, and this was reported to her GP. But the updation was given to her GP, but she got the appointment only tomorrow. The appointment of her GP to see her is tomorrow. So similar complaints were reported a couple of days ago, and the symptoms were subsided by the aforementioned drugs. So the aforementioned drugs here is normison and Panadol. She has a history of hypothyroidism, hypertension, glaucoma, for which she is on oroxin, Caravia, and Timoptol eye drops, respectively. So we could reduce the word count here. We have a lot of data which we seem to be very important to the letter, but actually we need to reduce the word count. So we have given the meaning almost clear there. Now, once we have said that, now the remote history, that's hypothyroidism, hypertension, and glaucoma, for which she is taking this thing, and this thing respectively. So we have written the present, the urgent history, the present history in the first paragraph. Today morning, what happened, why we, whether we reported to her GP or not. Yes, we have reported. Then, sorry, then she got, no, but she got the appointment tomorrow. Now she had a similar complaints. She had similar complaints. A couple of days ago, she had complaints of indigestion, chest pain, shoulder pain, and same drugs were given. Now, sorry, I have lost in between. I think we can start from here again. On her arrival, kindly confirm her current diagnosis. So we need you to confirm her current diagnosis on an emergency basis. So we need to do this urgently and provide her the best appropriate treatment. So that's it. If not, she is allergic to penicillin. This is what a reminder is. Please do not hesitate to contact me if you have any queries. Yours faithfully, I think it is night nurse. It's night nurse Golden Retirement Village. That's the name of the village, Golden Pond Retirement Village. That's it. Golden Pond Retirement Village. And that's it. That is the end of the explanation here. So we have got the date, the address, salutation, reference, date of birth, purpose as persistent chest pain and uncontrolled blood pressure, what she requires, urgent assessment, management, and care. What is exactly happening now, and the reason for my immediate transfer. So she had similar complaints ago, 2 days ago, and that was treated by the aforementioned thing. Her GP was at updated regarding her condition today morning, but she didn't get the appointment of her GP today. And regarding her past medical history, she has hypertension, hypothyroidism, and glaucoma, and we have the medications here, and we have not added some other medications, some vitamin C and glucosamide tablets. We have not added because that's because this is an emergency letter, so we have to see that into your mind. So this is the requirement. Upon the arrival, when you accept this patient, you please confirm her diagnosis on an emergency basis and provide her the best appropriate treatment. Now the penicillin. So I think we can make an alternate purpose paragraph like this. Thank you for accepting, Mrs. Bethany Taylor. That would be more good if you see there when you look. You are accepting. The emergency doctor is accepting the patient. So you can go with thank you for accepting. Mrs. Bethany Taylor. Thank you.